Yeah, I mean, it's obviously a tricky, challenging time for everyone. So I've been stuck in the house for just over 2 weeks now with the kids. So trying to do some homeschooling. So
How's that
yeah,
going?
yeah, it's been okay. It's challenging to say the least.
And how old are the kids?
So I've got a 7-year-old and a 3.5-year-old. So
Okay.
the 7-year-old's okay. Just the one that's younger, he's a bit wild.
Yeah, the age when they're running around and they just they don't want to sit still and stuff, right?
Yeah, definitely. So I need to kind of always kind of keep them entertained with something.
Yeah, 100%. They're not interested in dentistry or doing some online lecturing or anything.
They've watched quite a few webinars with me. Well, the older one's watched a few webinars with me in the past. So, but I think I've probably put him off. He doesn't want to do dentistry.
Fair enough. Yeah.
Yeah. So the last
Nice.
thing he wanted to do was be an archaeologist. So we'll see.
Yeah, my little cousins, they come out with a different one in like, you know, every other week. He's like, oh yeah, I'm gonna be a window cleaner. Then someone told him that windows cleaners don't earn very much, so he's now becoming a tennis player apparently. So, yeah, the kids are funny, man.
Yeah.
Mars is down there, bro. Salam, Mars.
Yeah.
So
You know,
obviously he did work experience with you, didn't he?
sorry?
Mars did work experience with you.
Yeah,
He
that's right.
said hi down in the comment.
Yeah.
Awesome. So obviously for the guys who don't know you, can you just say a little bit about kind of what you do, what you're up to within dentistry? Just so I've got a bit more of an idea. Obviously, a lot of guys had a little look at your profile, but just to hear from you.
Yeah. So my name's Tariq Bashir. Graduated in Glasgow 2005, and I've kind of done a lot of SHO posts up in Glasgow, kind of Dundee, Nine Wells, and Perth. So after that, I went into private practice in 2008 at the Visage Clinic, and so I was taken on by Atiq Rahman. You probably know him. So I've been working with Atiq since then. So I've been quite, quite lucky, quite fortunate to have a great mentor like Atiq, and working with them. And I've walked through obviously lots of different courses in the past. So recently completed the COIS program in Seattle.
Yeah,
Currently doing my MSc in endo. So
awesome.
yeah, I'm a bit of a course junkie. And then I set up the Scottish Dental Study Club a couple of years ago with my wife. So we run hands-on courses, run lectures, study club evenings, weekend courses now in Glasgow.
So your wife's a dentist as well?
Yeah, so my wife works part-time. She works 2 days a week just now.
Bit of a power couple, right?
I don't know about that, but yeah.
Awesome. So, guys, if you've got any questions for Tariq about those little bits that he's been speaking about, then definitely drop them in below. But I understand you've got some slides prepared for us, which is going to be really interesting to look at. So we'll go through a couple of the slides and we'll see if we get some questions in and around the treatment that you've been doing. Hi, Jock. Jock's one of the other guys we had talking about implants last week.
Okay.
Very, very knowledgeable guy. Okay, so you can switch your camera around.
Yep. I'll just flip it around, so we'll just
there we go.
Can you see that okay?
Yeah, that's perfect. So what did this patient come in asking for? What was the concerns and the expectations from the whole treatment plan?
So, well, this lady here, she was referred by an orthodontist who's an external from an external clinic, and she was looking to have the diastema closed between the two front centrals. So he recommended composite bonding because everything else was fairly well aligned, and to get a stable result, we did some composite bonding just to close the central gap, the middling vessel. So I've done quite a lot of cases like this, and this is another case that's pretty similar. So there's a fan waving.
Yeah,
the big man's on. So this patient had some spaces around around the laterals, and he came in looking for veneers. And in his case, we managed to get him cleaned up with a hygienist, did some whitening, and did some composite bonding again, close up those spaces. So we got a good result for him. Let me see what other ones. This one here is quite a good one. So this was the daughter of a dentist. So no pressure here. So yeah, her mum stayed in and sat in and all the treatments. So we did some whitening, So here I've got some composite buttons on the teeth just to try and get an enamel shade match.
Yeah.
Yeah, looking at it in black and white to try and kind of check the value of those. So this is me starting to remove the composites. Okay, so removing the composites, creating a bevel, and then, you know, ensuring there's enough space, looking at the kind of lateral view as well.
Yeah.
Creating the palatal shell. Again, checking, making sure we've got enough space for the dentine and the translucency. Building those up, marking in the line angles, and this is her finished.
Yeah, so, really, really good result there. Really nice result.
So we got a good result with that lady. This is a slightly different kind of case. A lot of black triangles. Perio patient. So perio was stable, but she came in. She was referred by another dentist. This lady had her daughter's wedding coming up. So she had quite a high smile line. Showed a lot of these spaces. So the kind of the only thing we could really offer is do some composite bonding to, you know, close up some of those spaces. So rubber dam on, floss ties on, cleaned out any kind of decay, any areas that were kind of not quite right, and then started to build up. And then
got a question there. Was there any mobility with these teeth when you started? You did say it was stable, didn't you?
Yeah, but this upper left too.
Yeah.
Mobile, maybe about grade 1 mobile.
Okay.
Everything else was okay, but this was the kind of most notable one. This is the one that I was kind of worried about, but we decided to try and just keep it going. And then I did perio splint at the end. So this was her straight after. So there is a bit of dehydration, and so this is where we've gone from there to there. And you know, she was happy, and she sent me this message on Instagram from the wedding.
So couldn't have smiled like that without you at my daughter's wedding. Couldn't have smiled like that at my daughter's wedding without you. Thank you so much. Yeah, it's really good to have, you know, feedback from the patients that come through like that. What do you do in terms of your pre-op planning? Because that's where maybe a lot of younger dentists sometimes go wrong. They take on cases that they maybe shouldn't, cases that maybe need some different treatment. What do you think your big kind of pointers are to let the guys know, all right, this is the line where composites no longer required and you need something different?
Yeah, I think with regards to composite bonding, especially when you're doing treatment planning for that, we need to look at initially, you need to, I think, look at full mouth treatment planning. There's no point in trying to just plan just for those anterior teeth, because a lot of patients will come in and that's all they want. And it's something that one of my mentors is John Cloyce, and he calls that patient's way. So patients will you can try and twist your arm into just doing a certain thing. But obviously, you know, you're the professional, and you know, we know what's right and what's wrong. So I think we can try and steer them away, you know, from, for example, just getting, you know, that kind of bright white smile, chocolate teeth, and they've got cavities in the back teeth, etc. So we need to look at the occlusion, look at the obviously caries, look at any oral hygiene, perio issues. But I think in the occlusion and tooth wear is a big problem just now, and it's something that a lot of younger dentists don't really understand. And it's something that they kind of gloss over and ignore to an extent, unfortunately. And I think part of that is because of the kind of the undergraduate training or teaching isn't, you know, always covering that. So, you know, they'll plan just to do composite veneers or composite bonding, but they don't really know why that's happened in the first place. So that's one thing I always talk to patients about. You know, if you don't, you know, plan to, you know, stop that happening again, then there's no way that any composite iad or any porcelain iad is going to last longer than the natural enamels lasted.
Yeah.
So I think it's important to kind of, you know, hammer that in to patients at the beginning. So whether they need any alignment, whether they need any, you know, splint therapy or, you know, any kind of occlusal management, that needs to be done first.
So with regards to actual occlusal management and diagnosing that occlusal parafunction or error, what are the things that you're looking for? Obviously, we've got obvious things like, you know, glossy appearance palatally for erosive wear, the wearing down of your lower incisors for maybe more attritive sort of wear. Loss of posterior support as well is a big one in a lot of the UK.
Definitely. I mean, a lot loss of obviously posterior support. That you know, you see still a lot of patients, and we even get, you know, referrals for patients for implants. and they're just looking for example, a lateral tooth or a central tooth, and they've got no posterior molars. So obviously anything, you know, that isn't going to kind of create instability, there's no point, I think, in pursuing that and, you know, giving that to a patient. So obviously you're looking for any kind of palatal wear, any edge chipping, any kind of canine wear, any kind of wear facets on the posterior teeth. So
yeah,
usually I would, you know, take any study models, you know, and then get them mounted up, look at them with our technicians, and then trying to kind of, you know, work out what the occlusal scheme is, what we're trying to do, if we're increasing the OVD, increasing the vertical dimension.
yeah.
So yeah, I mean, there's a lot of kind of different factors you need to look at. I think it's very easy just to kind of slap on composite and polish it and, you know, make it look great, but, you know, there's no point in doing that if it's not going to last.
No, absolutely. And is there any good courses out there that you would maybe recommend for people to maybe go ahead and look at, or even some articles and things that will help the younger guys get into that flow of understanding the occlusion a bit better?
Yeah, I mean, with regards to tooth wear, like I did a course with Didier Dici in Geneva. He's you know, a really good mentor and, you know, a really good clinician. And there's a lot of, you know, guys that have been over and obviously set up courses similar to that. You know, for example, Andrew Chandapal, he does courses on tooth wear. I've been on his course before as well, and it's kind of centered on some of Didier's principles. I did the occlusal stuff with John Coyce in Seattle. It's an excellent course, but it's not easy to kind of get to Seattle every so often, and so expensive. So it's something to kind of, I think, aspire to doing longer term. But I think that, I mean, there's always a lot of occlusal courses in the UK. I've done the restorative course with Basil Mizrahi.
Yeah, he's good. He's good.
Yeah, and I watched one of his webinars tonight, just before this. So, you know, he's a fantastic clinician. So I mean, we're lucky we've got a lot of good, you know, good kind of clinicians around the UK.
Yeah, and you said that you're also moving into doing an MSc within endo. Myself, that's kind of my goal of probably becoming an endo specialist. Why have you kind of done a bit of everything? Do you see yourself as kind of skilling up as many areas as you can, or are you going to go down one route eventually?
To be honest with you, when I was maybe younger, like say 10 years ago, I used to think that, you know, I could be a general dentist, good at everything.
Yeah.
But as you get older, you realise it's not really possible. It's not you know, no one's superhuman. You can't be good at every single thing. For example, I mean, I can place implants, I can restore implants, you know, do ortho, do prosthodontics, fixed pros, composite bonding, endo. I do every kind of area of general dentistry. But now I've kind of started to kind of find a kind of more of a niche, kind of hone down into kind of more composite bonding, you know, fixed pros, endo. So more kind of restorative based.
Okay. Yeah, because obviously you've got to have that wealth of experience initially before you then decide where you're going to go.
Yeah.
So it makes sense that you spent some time and explored each option, and then kind of zoned in on the bits that you enjoy and probably best at as well.
Yeah, exactly. I mean, it's interesting to say, you know, hear that you want to go down endo as well. What do you like about endo? What is it?
I think I was always good at it during uni. It was the one area where I felt like I was instantly comfortable, whereas with other bits and pieces, I was really struggling. Not struggling so much, but like it didn't click. And then since I've come out, I'm lucky to work with a scope and magnification, and I just feel comfortable doing endo at the moment. Obviously, I'm not amazing. You know, I've not done all the further experience, and I don't have 10 years behind me. But for example, I went on a couple of courses in Chicago. I went on an endo one. I went on some composite bonding courses, and I went on one for kind of more veneers, you know, the American style veneers, because that was something that I'd never had any exposure to. And I was totally bored during the composite lecture. For the first time, I thought, oh, this is going to be really good. And I spent quite a lot on that course. And the full day, and I was like, this is the worst thing that I've ever done. I have no interest in it whatsoever.
It's the worst when that happens, isn't it?
Yeah. Then the other guy, it was actually a free lecture, the one who showed a lot of his veneer course cases. Really interesting, but I was like, I'm just not interested in this kind of work. And the endo day was with a guy called Brett Gilbert. I don't know if you've heard of him. He's a lecturer and specialist at the University of Chicago, and it was 8:30 till 5:30, and only in the last 45 minutes did I start to flag. And that's never happened to me before. And I was like, you know what, that kind of just, that sums it up. I know what I want to do now. So yeah, from that point, then I was like, you know, I need to start looking into further education and training. So I think I had it in my mind that I wanted to do it for a long time. You're being told off for telling everyone to do endo by Imran.
Okay.
But yeah,
I'll stop there then. No, but I mean, I find endo enjoyable. Like, I initially never planned to do an MSc in it. I started with Simply Endo. I don't know if you know Mike Horrocks, really fantastic guy in Formby. They've got a really good setup, and I started with them about 5 years ago in Altrincham, when they had a small centre there. So I did the 10-day course initially and did the certificate, and then I went back a couple of years ago and did the diploma last year. So this is kind of my master's year. So I'm doing a dissertation on that, and hopefully get that finished off.
And once you finish the dissertation and the diploma, is that something where you're then able to apply to a specialist register, or are you still kind of a step underneath?
I mean, yeah, I mean, you can't really go to specialist level after doing an MSc in the UK. It needs to be kind of hospital pathway. Or you know, sometimes with the implant dent you can look into that, but that's still quite tricky. It's not easy to, you know, get into that. So I think if anyone's looking to kind of go into kind of specialist training, is to look at a hospital pathway, and you know, most universities will do like a 3-year,
implant dent.
Yeah. So, is that what you're looking at?
Yeah, probably gonna have to sell an arm and a leg. But I think if you're enjoying something, you've got to kind of go both in and go for it. Any fellowship courses from the US or UK for an international dentist? Yeah, all of these courses, Shiv, are ones that you can apply to via, certainly the university ones you've got to apply to via the individual institution. It might be an international rate though, so you might be paying quite a lot. And it's very challenging, but amazing when we use these skills to help people save people's dentition. Yeah, I'm also really bad at taking teeth out, so I'm not sure I've tried it. That might be part of it.
I think there is now a general kind of shift towards teeth rather than, about 10 years ago there was a kind of big push towards like all in four, but now I think there is more like kind of trying to restore as much as you can.
Yeah, of course there are cases when you've got hopeless perio teeth where eventually they do have to come out, and then that sort of thing becomes viable and useful as the best option. But I'd always try and save a tooth, especially in younger patients, before we're trying to take them out, because you're just setting them on a pathway to losing another one and another one. Yeah. Iman is trolling in the comments. How does Tariq like his steak? This is because I like a medium steak.
I don't know. I think Iman's been smoking something.
Am I going through DCT? No, I'm going to go straight towards an MClin dent, probably via a university entry. It looks like that way. COVID-19 protocol. What's happening up in Scotland, man?
Basically, for the last 2 weeks, we haven't been able to do any aerosol-generated procedures. So I think the Scottish CDO was actually quite proactive, and the Welsh, compared to the English counterpart down here.
Is that Chris Day?
Sorry?
Is it Chris Day, the Scottish CDO?
No, Tom Ferris.
Oh, yeah.
Yeah, so, I mean, they came out quite early with a kind of a protocol that no aerosol procedures. So initially for a couple of days, we were just doing, for example, reviews and checkups and things. But then after the weekend, they said no aerosol procedures. So basically, we couldn't do any work at all. So.
Yeah, so you on phone kind of duty, just, if patients call up.
Yeah, triaging patients. And obviously if they need seen, then there's obviously the dental hubs for any kind of treatment that they need.
Yeah. How's that been? Because obviously there's kind of like a part of you that goes, this guy's in pain, we need to be doing something.
Yeah,
it's not safe for either of you to do it at the moment.
Yeah, I mean, obviously it's tricky when you do have a patient who's obviously in severe pain. But luckily, thank God we haven't really had any. I haven't had any phone call from any patient that's needed anything that urgently.
Yeah.
But it's good that there is obviously kind of provisions kind of set up now. I think in some places you still hear that they don't have anywhere to refer patients, and some colleagues are finding it difficult.
Yeah, we're still in that kind of bracket where we've been told there are places, but the people who are working in those places are telling us there's no masks. So
Yeah,
they're essentially being forced to work with inadequate equipment, which is pretty poor, really. So hopefully the situation will improve soon, and everyone's going to be safe when they are seeing these emergency patients.
yeah. I mean, I think I've got a lot of friends who are medics, but unfortunately, you speak to them, and the PPE that they have isn't really adequate, for what they're doing, and that they're seeing, COVID patients.
Yeah.
But I think that's just part of the problem, isn't it? There's with the NHS at the moment, that
Yeah,
they're prepared for it.
yeah. Hopefully things will settle themselves out. I think in Scotland you're maybe a little bit better off than they are down south, especially in like London and places like that. Iman's asking more questions for you here. Do you see that one? Who's Tariq's favorite dental student?
No comment.
It's not you, Iman. I'm not bullying.
It's a man if it keeps it quiet.
Talking of dental school and dental students, how was Glasgow as a dental school? Obviously, my cousin's just come out of the dental school there, so I do know a little bit about it. But how did you find the whole process there?
I mean, Glasgow Dental School is a very big school, and I enjoyed my time there. Like any dental school, there's always kind of some areas that you feel haven't been covered properly or adequately. But I was a visiting GDP there for 3 years,
Yeah.
and I gave up about 2015. I mean, I enjoy teaching, and you see kind of students kind of develop and flourish. So I mean, I think it's improved a lot since I've left. There's been a lot more funding, in the school. All the departments have been refurbished, and it's a lot more modern. And it does very well in the rankings every year now. So Glasgow's definitely a very good dental school now.
Yeah, I've definitely heard good things, obviously, about the people coming out. There's a lot of guys like yourself who are doing very, very good and kind of almost gold standard work, and doing it in practice where you can show an example that it's possible to do that. What has been like the biggest challenges since you left for you that kind of can give us an idea of things to look out for and places where we can avoid making mistakes that maybe you wish that you'd known before?
I think working in practice. Well, when I left, when I finished VT, I did 2 years of SHO posts, max fax, and then restorative, and then I went straight into private practice, and I probably went into the best private practice in Glasgow, like one of the top ones. And I think doing that, it wasn't easy, and one of the things what I found difficult at the beginning was managing patient expectations. And I think especially when patients are paying a lot for treatment and they're expecting a lot, a lot of the patients. I mean, we've got some great patients, but when you're doing complex treatments, you need to be able to, deliver to that standard and that level, and you need to know your limitations. And I think as young dentists, sometimes when you qualify, you don't know that. And I was never that kind of dentist, but I think it's very easy to kind of fall into that, and try and do everything at a young age, but when you need obviously to kind of go on further courses, get a good mentor, get some good training under your belt before you try and tackle everything. I mean, some of the funny things I remember from my time as visiting GDP at the dental school recently was I had a couple of fourth year dental students asking me which implant course to enroll onto. So as soon as they finish, they can start an implant course because it's got a 2-year waiting list. And I was like, you guys can, you're prepping a crown, you're learning how to prep a crown today,
Yeah.
You don't need to be looking at doing implants straight after VT. This time, this progression, obviously, and I think sometimes, young dentists, are always too eager to progress.
You don't get to see your own failures very soon. That's part of it, I think. So they don't have that kind of humbling experience of someone coming back and a crown has, debonded, or it's just, a filling's just completely chipped off. Whatever it might be. So you're just like,
100%.
yeah, I did that. That's cool. I can do the next thing now.
Yeah, I mean, I've been in the same practice for 12 years, so
Yeah.
you see things coming back, and then you learn why that's failed and why that's worked. And I think when you know that you're staying in that practice for a while, you make sure everything works or as best as you can, because the patient's going to be coming back, like you see with the crown in the hand, saying, you did this a year ago and it's fallen out. Why is it broken? I think it's good to try not to move around too much either. So you do see that you see the follow-ups,
Yeah.
track patients.
Iman's asking, would you recommend to do COIS?
100%. I think if you can, sacrifice the time, commit to it. Definitely. I mean, I've done a lot of courses, and I don't think anyone would disagree who's done his course that he's probably by far the best dental educator I've ever come across. 100%.
What was so good about him compared to everyone else? Can you put your finger on it?
I mean, he's probably the only lecturer I can sit and listen to all day. I mean, his course starts at 7 a.m., finishes at 6 p.m. Okay, so sometimes you're doing 5 days straight. And the guy's a dental encyclopedia. He knows everything, and I mean everything. And I mean, he's in his mid-60s, but he'll show you 30-year follow-ups, 35 years, cases, and he still sees the same patients. And most of his patients now are dentists. So he doesn't actually. I think he only practices 2 days a month in dental practice, but most of his patients are dentists. It's just his kind of thinking pattern, his logic, his treatment planning is just by far the best I've ever come across.
Awesome. How important is that? I know you've mentioned it a couple of times, having a mentor along the lines of Atiq, other people like that. How important is that for younger guys to kind of step up?
I mean, I think it's very important, to be honest. I think especially nowadays when everyone has a lot of the younger guys are doing more private treatment, take on more complex cases. I think it's always good to have even if it's not an official mentor, or even some colleagues or more experienced in your own practice or your principal. You need to speak to people. You need to bounce ideas off each other, and that was part of the reason why we set up our study club in Glasgow. Because I used to have a lot of young dentists showing me cases, just sending me emails or photographs, radiographs and things, asking my opinion. But I think so. Initially, the thought process was to get together, have like a round table study club, where we just kind of bring cases and discuss cases, and then it kind of grew our arms and legs, and we started doing lectures, etc. as well.
Yeah, and so what kind of things are you lecturing at the moment?
I personally, I lecture. I do a hands-on anterior composite course, and part of the study club, we get a lot of external speakers. So we've run rubber dam courses, endo courses, oral surgery, BOPT technique. We've got composite courses, icon, peds courses, anything you can think of, we've probably covered it.
Yeah, and if some guys want to come and hear you speak or go to one of these courses, where can they get involved with that?
We've got a website, scottishdentalstudyclub.co.uk.
Okay, send me the link to that at the end, and I'll put a story with a swipe up so guys can have a little look at that.
Yeah, perfect. We've got obviously an Instagram page as well.
Okay,
perfect. Thanks.
Brilliant. Any last couple of questions for the big man here, because we are taking up a lot of your time. I'm sure the kids need some more attention. Don't let run too much havoc around your wife.
Thankfully, the kids are asleep. I mean, made sure that they're asleep beforehand, because I could just imagine them walking in and wanting to feature in this webinar.
It's fine. We're kid friendly here, as long as I don't have to teach them right now.
Yeah.
So yeah, what kind of things do you, just while we're waiting, what kind of things do you do in your spare time outside of the clinic to keep yourself grounded? I think that's something that's becoming really, really important these times where everyone's stuck at home and unable to do anything else.
Yeah, I mean, to be honest, a lot of my free time is taken up, but just with the kids, and I try and because obviously like yourself and most dentists, we work hard, and we're always obviously out the house, either in clinic or on courses, etc. So when I'm at home, I try and make sure that I'm spending time with the kids, taking them out. And obviously it's difficult just now when you are just stuck at home. But today we kind of spent a lot of time in the garden, and tidying up the garden. I will, to be honest, I'll be honest with you. My wife did most of that, and I better put that in before she comes up with a comment.
Is she watching?
She's probably listening in.
And one last troll question from Aman. When you coming to Herdal?
Man, just let me know when you're in Glasgow.
Yeah, well, steak only, and it's going to be medium rare.
Listen, man, how are you keeping busy? Are you?
I'm doing 2 or 3 webinars a day with loads of different dentists. We've had a couple of really, really interesting guys already. People like yourself who are, doing some education to other dentists, just hopefully trying to get some learning done whilst everyone can't do anything. And some more kind of chilled out ones. So we had a young girl on earlier who's a dental student. We had more of a chilled out chat and took some questions. Other than that, I'm doing a lot of Netflix, a lot of eating, and going through a lot of the tea reserves at home, to be honest.
Yeah.
But yeah, no, it's been really nice having you on.
Thanks for that.
Really, really interesting to see the cases that you brought on with you. I think that's something that we definitely want to see a bit more of. So I'll be asking the guys who come on after to do the same. Just say Tariq's leading the way.
Yeah, I mean, I've got plenty more cases, and I'm more than happy to go through them again with you at some point.
Yeah, if you're getting bored during the shutdown, we'll make like a regular, just a quick thing, 25 minutes or something like that.
Yeah.
Through one case, get some questions going.
More than happy.
Yeah, it's been really good. For everyone else who's listening at the moment, I'm just going to run quickly through the next couple of days so you know who's coming up. So tomorrow we've got 2 really good speakers coming in. We've got Rina Wadia from London, who's a periodontist. She's got a free set of email kind of perio kind of e-learning bits and pieces for us. She's going to tell us a bit more about that and hopefully answer some questions maybe around the new perio guidelines, anything that you guys could come up with in the evening. So that's at 4 p.m. I might be wrong now. I've not actually put it in my diary yet. But at about this time tomorrow, 10 p.m., we've got Gil Villavecca from the United States. And he's going to talk to us about owning a dental laboratory, things that he wants to see from us dentists when we're writing them a prescription, what's going to help him out. And maybe a bit about digital smile design, digital dentistry kind of upcoming, and all those bits and pieces. On Tuesday, we've got Rizal Rizki Akbar from Jakarta, Indonesia. He's one of the best dentists I've ever seen, so you definitely want to be checking that one out. He's going to talk to us a lot about how he's skilled up so quickly in his quite short career. He's only 30 years old, but he's already working at very, very high standards, so that's definitely something to look for. Then we've got Shiraz Khan at 8 p.m. on Tuesday as well, so we've got a double header there. And then we've got a couple of days of orthodontics. So we've got Queen Invisalign and Stefan Decker on Wednesday and Thursday. And then hopefully we'll get some more speakers in there, but that's all I've got booked for the moment, guys. Hopefully we'll see you all there. Massive thanks to Tariq for coming on and showing us some of his cases. Inshallah, we'll do a couple more soon for sure.
Yeah. Thanks very much.
Yeah, no problem. See you later, man.
Take care. Bye-bye.
Bye. Yeah, big thanks to Tariq for doing that case presentation for us. A couple of cases that are really interesting. Iman, if you come up with a really good topic and something that you're going to come through for, then let me know and we'll have a look at it. But I don't want to be trolled about having medium rare steaks for an hour. If any of you guys have got any questions, hit me up in the direct messages. And if you've got any ideas of people that you want to see speak, I'll definitely take any suggestions. Just let me know. Thank you. I'll see you tomorrow. I'll see you tomorrow, guys.